Good morning friends, welcome to my channel Medics Tutorial. This is the third video of the urinary system and today's topic is anatomy of the urinary system. First we'll see introduction to the anatomy of urinary system. The urinary system eliminates excess water, salts and physiological waste by producing urine. In this section we consider the functional anatomy of the urinary system and its components are the kidneys, ureters, urinary bladder, and the urethra. In later section, we consider how the kidneys remove metabolic waste from the bloodstream to produce urine, how the process is regulated, and how urine is eliminated through the passageways of the urinary tract. In this image, you can see there are two kidneys, two ureters, one bladder, and one urethra. In this in this video, we'll talk about them one by one. Now, first talk about the kidneys. There are two kidneys in human body which are metabolically very active. Even at rest, they receive roughly 25% of the cardiac output. The kidneys perform excretory functions of the urinary system. Also, they produce urine, which is a fluid containing water, ions, and small soluble compounds. The ureters. It receives urine from the kidney and conducts it to the urinary bladder. The urine movement involves a combination of gravity and a peristaltic contraction of the smooth muscles in the walls of ureter. Please do remember, it's very important. Urine movement involves a combination of gravity and a peristaltic contraction of the smooth muscles in the walls of the ureter. Now, the urinary bladder. It receives and stores urine prior to its elimination from the body. The contraction of smooth muscles in the walls of the urinary bladder drives urination, which means the ejection of urine outside the body. The urethra. It is a passageway that conducts urine from the urinary bladder to the outside of the body. Kidneys. The kidneys are paired retroperitoneal organs. They are bean-shaped and present retroperitoneally in the posterior abdominal region. They lie in extraperitoneal connective tissue immediately lateral to the vertebral column. In the supine position, the kidneys extend from approximately T12 vertebra superiorly to the L3 vertebra inferiorly. The right kidney is somewhat lower than the left kidney because of its relationship with the liver. Although they are similar in size and shape, the left kidney is longer and more slender organ than the right kidney and nearer to the midline. In this module, you will learn the locations of the kidney and their placement in relation to axial skeleton and organs of the abdominal pelvic cavity. Also, you will see how the kidneys are supported, protected, and stabilized in the position. This is the anterior view, shows kidney, ureters, urinary bladder and associated blood vessels. Because the kidneys are in retroperitoneal position, they are clearly visible in anterior view only after other abdominal organs have been removed. As you can see the urinary system in this image, just because we have removed the anterior abdominal structures like stomach, pancreas, liver, small intestine, large intestine, etc. As you can see, these are two kidneys which are covered by renal fascia. Renal fascia, which is a dense fibrous outer layer that anchors the kidney to the surrounding structures. Now we'll talk about the kidneys. A typical adult kidney is reddish brown and about 10 centimeter long, 5.5 centimeter wide, and 3 centimeter thick. Each kidney weighs about 150 gram in adult male and about 135 gram in adult female. As you can see, this medial concave shape, it's a hilum, a prominent medial indentation. It is the point of entry for the renal artery and the nerves, and the point of exit for the renal vein and the ureters. The ureters pass inferiorly and cross the surface of the external iliac artery and the vein before emptying into the posterior inferior surface of the urinary bladder. As you can see in this image, ureters pass anteriorly to the external iliac artery and the external iliac vein. Now, as we can see in this image, this is the cut edge of the posterior peritoneum which has been removed. The kidneys, adrenal glands and the ureters lie between the muscles of the posterior body wall and the parietal peritoneum in retroperitoneal positions. Here I would like to add some concepts regarding this image, as it's very beautifully showing here. So first concept is the right kidney is superiorly placed. Sorry. The left kidney is superiorly placed than the right kidney, as the right kidney, just because the right relationship of the right kidney with the liver. And second concept is the left kidney is nearer to the midline than the right kidney. Third and fourth concept is regarding to the aorta and the vena cava. As you can see in this image, the left kidney is nearer to aorta and the right kidney is nearer to the vena cava. So it's obvious their branches are nearer to the nearer kidney and far to the farly placed kidney. So third concept, the left left renal artery is shorter than the right renal artery, or we can say that right renal artery is longer than the right renal vein. Got it? Same for the vena cava, as vena cava is nearly placed to the right kidney, so right renal vein is shorter than the left renal vein, or we can say that left renal vein is longer than the right renal vein. So very simple, no need to memorize it. Just whenever you got questions on this, just try to recall this image and you will get your answer. Relationships of the kidney with the other structures. The anterior surface of the right kidneys is related to the numerous structures, some of which are separated from kidneys by a layer of the peritoneum and some of which are directly against the kidneys. This image showing the relationships of the anterior surface of the right kidneys. A small part of the superior pole is covered by a right suprarenal gland. Moving inferiorly to this, a large part of the rest of upper anterior surface is against the liver and is separated from its by a layer of peritoneum. Medially, the descending part of duodenum is retroperitoneal and contact the kidneys. The inferior pole of the kidneys on its lateral side directly associated with the right colic flexure, and on its medial side it's covered by a segment of the intraperitoneal small intestine. The anterior surface of the left kidney is also related to the numerous structures, some of which are some of some of with an intervening layer of peritoneum, and some are directly against the kidneys. This image showing the anterior surface relationship of the left kidney. A small part of the superior pole on its medial side is covered by left suprarenal gland. The rest of superior pole is covered by the intraperitoneal stomach and the spleen. Moving inferiorly, the retroperitoneal pancreas covers the medial part of the kidneys. On its lateral side, the lower half of the kidney is covered by the left colon flexure and the beginning of the descending colon, and on its medial side by part of the intraperitoneal jejunum. Now we'll talk about the posterior relations of the right and the left kidneys, as both are related to similar structures. This image shows the relationships of posteriorly right and left kidneys. Superiorly it is related to diaphragm, and inferior to this, moving in medial to lateral direction. It is related to the three muscles, which are psoas major muscle, quadratus lumboris muscle, and transversus abdominis muscle, which are moving medial to the lateral. The superior pole of the right kidney is anterior to the 12th rib, while the same region of the left kidney is anterior to the 11th and 12th rib. This difference occurs just because the left kidney is superior to the right kidney. The pleural sac, and specifically the costodiaphragmatic recess, therefore extend posterior to the kidneys. Also passing posteriorly to the kidneys are the subcostal veins and nerves, the iliohypogastric and ilioinguinal nerves, which passes posteriorly to the kidneys. This diagram shows a section view of kidney with its major landmarks and the features. The the blood vessels servicing the kidney enter through the hilum. Now, here we'll talk about the major structures and landmarks of the kidney. First, we'll talk about the fibrous capsule. As you can see, it is the fibrous capsule of the kidney which covers the kidney. It is covering fibrous capsule. It is covering the outer surface of the kidney and also lines the renal sinus. The fibrous capsule covers the kidney from outside, and it also covers the renal sinus, which is the spaces in between the kidney and internal cavity. Renal sinus, it is an internal cavity within the kidney. The outer and inner lining are continuous at the hilum. Within the renal sinus, the fibrous capsule stabilizes the position of the ureter, renal blood vessels, and the renal nerves, renal cortex. So this area is the renal cortex. As you can see, this is the renal cortex. It is a superficial region of the kidney in contact with the fibrous capsule. The cortex is a light reddish brown and granular structure. As you can see, it is a light reddish brown and granular structure. Now, renal medulla. This is the renal medulla. This is the renal medulla, as you can see, extends from the renal cortex to the renal sinus. It extends from the renal cortex to the renal sinus. This is the area underlying to the renal medulla. The medulla is the inner darker reddish brown region of the kidney. It is the inner darker reddish brown region of the kidney. Now, now the renal pyramid. This is the renal pyramid. As this one is the renal pyramid. It is a conical structure extending from the cortex to tip, from cortex to tip of the renal papilla, called the renal papilla. Renal column. It is a band of the granular tissue that separates the adjacent pyramids. It is a band of granular tissues that separates the adjacent pyramids. As you can see, this is the renal column as it's separating the renal medulla. Now the kidney lobe. This is, as showing, this is the kidney lobe. This is the kidney lobe here. It consisting of a renal pyramid, the overlying area of the renal cortex, and the adjacent tissue of the renal column. It includes the renal pyramid, overlying area of the cortex, and the overlying area of adjacent renal cortex. Each kidney contains 6 to 18 kidney lobes, and the urine is produced in the kidney lobes. Here, here is a frontal section of the human kidney, which shows the pathway of newly formed urine from within the kidney into the ureter. So, as the urine get formed, it as the urine get from and it enters to the renal papilla through the papillary duct. It it called the filtrate will call the urine. So after entering the renal papilla, it enters to the minor calyx, then major calyx, then renal pelvis. After that, it enters to the ureter, then bladder, then the urethra, and then it get passed outside the body. So minor calyx collects the urine produced by a single kidney lobe. As we said, urine get formed in the kidney lobe. So from kidney lobe, it enters into minor calyx. Then from minor calyx, it it enters the major calyx, which forms through the fusion of 4 to 5 calyxes. Then from major calyx, it enters to the renal pelvis is a large funnel-shaped structure that collects the urine from the major calyxes. The renal pelvis, it is a continuation with the ureters. Nephron, it is a structural and functional unit of the kidney. It can be divided into regions, and each region has specific functions. A nephron is a microscopic structure that performs essential functions of the kidney. A nephron consists of a renal corpuscle and the renal tubules. At the renal corpuscles, blood pressure forces water and dissolved solutes out of the glomerular capillaries and into the chamber, that is the corpuscular space, that is continuous with lumen of the renal tubule. At the renal tubules, filtration produces an essential protein-free solution known as a filtrate that is otherwise similar to the blood plasma. After being modified by the renal tubule and collecting systems, the filtrate leaves the kidney as a urine. As you can see in this image, it shows the nephron and its major components as a renal corpuscle, proximal convoluted tubules, nephron loop, and distal connective tubules. Mm, uh, these four parts forms a excretory system of the kidney, which mainly forms urine. So first we'll talk about the renal corpuscle. The renal corpuscle, it is it's a spherical structure, consists of a glomerular capsule. It is a cup-shaped chamber approximately 200 micrometer in diameter and is a capillary network known as glomerulus. So the proximal convoluted tubule, it reabsorbs nutrient from the filtrate, now known as tubular fluid. Nephron loop, it have four parts. As you can see, this is the first one, the thick descending limb of Henle loop. This is the thin descending loop of the Henle loop, and it is a thick ascending limb of the Henle loop, and this is the thick ascending loop of Henle loop. So the nephron loop stabilizes an oncotic pressure in the renal medulla. This gradient promotes water reabsorption from the tubular fluid in the nephron and collecting system. Distal convoluted tubule makes further adjustment in the composition of the tubular fluid through a combination of the secretion and the reabsorption. As you can see in this image, it is the collecting system of the kidney, which mainly forms from the collecting duct and the papillary duct, which papillary duct opens in the renal papilla, then minor calyx, major calyx, ureter, further like this. So each nephron empties into the collecting system, a series of tubules that carry tubular fluid away from the nephron. A collecting duct receives the fluid from the many nephrons. Each collecting duct begins in the renal cortex and descends into the renal medulla, carrying fluid to the papillary duct that drains into the minor calyx. So, collecting system. The collecting system receives the urine from the individual nephron and performs final adjustment in the urine volume and composition before delivering it to the minor calyx. collecting collecting duct carries tubular fluid through the oncotic gradient in the renal medulla. Papillary duct, it collects tubular fluid from the multiple collecting ducts and deliver it to the minor calyx. as it travels along the renal tubular fluid gradually changes in composition. The The characteristic of the urine that enters the mechanical leaks vary from moment to moment depending on the activities underway in each segment of the nephron and collecting systems. There are two types of the nephron. First one is the cortical nephron, and second one is the juxtamedullary nephron. The only difference in between these are the cortical nephron entirely present in a cortex and the juxtamedullary nephron present in cortex as well as renal medulla. So, roughly 85% of nephrons are cortical nephrons located almost entirely within the superficial cortex of the kidney. The remaining 15% are the juxtamedullary nephron, which have long nephron loops that carry that carry that extends deep into the renal medulla. The juxtamedullary nephrons stabilize condition in the renal medulla that are essential for conserving water and producing concentrated urine. As you can see in this image, this is the renal cortex and this is the renal medulla. This nephron is mainly present in a renal cortex. That's why it's known as the cortical nephron, and this nephron is mainly present in a renal medulla. That's why it's known as the juxtamedullary nephron. Vasculature of the kidneys. The kidneys are highly vascular. The circulation pattern are complex. A single large renal artery, which is a lateral branch of the abdominal aorta, which supplies each kidney. These vessels usually arise just inferior to the origin of the superior mesenteric artery between vertebrae L1 L2. The left renal artery usually arises a little higher than the right kidney just because the left kidney is superiorly placed than the right kidney, and the right renal artery is longer and passes posterior to inferior vena cava. The right renal artery is longer than the left renal artery just because the aorta is nearly placed to the left kidney and pass posterior to the inferior vena cava because the aorta is posterior to the inferior cava. As each renal artery approaches the renal hilum, it divides into anterior and posterior branches which supply the renal parenchyma. Accessory renal arteries are common. They originate from the lateral aspect of the abdominal aorta, either above or below the primary renal arteries, enter the hilum with the primary arteries, or pass directly into the kidney at some other level, and are commonly called extrahilar arteries. Multiple renal veins contribute to formation of the left and the right renal vein, both of which are anterior to the renal arteries. Importantly, the longer left renal vein crosses the midline anterior to the abdominal aorta and posterior to the superior mesenteric artery, and can be compressed by an aneurysm in either of these two vessels. As shown in this figure, the left renal vein is longer then the right renal vein, and it is anterior to the renal arteries as seen in this figure, just because the uh, vena cava is anteriorly placed to the aorta, and the left renal vein is posterior to the superior mesenteric artery. So it's obvious, if there will be any aneurysm, it will compress the renal if there will be aneurysm in between the in aorta or the superior mesenteric artery, it definitely compresses the left renal vein. The lymphatic drainage of the each kidney is to lateral aortic lumbar nodes around the origin of the renal arteries. Around the origin of the renal arteries, here is some placed lymphatic nodes, the lateral aortic lumbar nodes. Each kidney has approximately 1.25 million neurons with a combined length of about 145 kilometer, that is about 85 miles. Both the cortical and juxtamedullary nephrons are innervated by the renal nerves that enter at the hilum and follows the branches of the renal arteries. Most of the nerve fibers involved are sympathetic prostoganglionic fibers from celiac plexus and the inferior sympathetic splanchnic nerves. Most of the nerve fibers involve the sympathetic postganglionic fibers, which forms from the celiac plexus and the inferior splanchnic nerves. The sympathetic innervation adjusts the blood flow and the blood pressure at glomeruli and stimulates the release of the enzyme renin. This diagram shows the arterial system supplying the kidneys and the venous system draining the kidneys. So firstly, each kidney receives blood through the renal artery. This is the renal artery, which originates at the aorta near the origin of the superior mesenteric artery, which get divides into segmental arteries. These are the segmental arteries from through the branching of the renal artery inside the renal sinus. Segmental artery divides into the interlobar arteries, as you can see here. These are the interlobar arteries. Interlobar arteries are branch from the segmental arteries and radiate outward within the renal column, as you can see it moving inward inside the renal columns. Then it originates arcuate arteries, which are originate from interlobar arteries and arc along the boundary between the renal cortex and the renal medulla. As you can see, these are the arcuate artery. It's getting arc, that's why it's known as the arcuate artery. Then arcuate artery give rise to the cortical radiate artery. These are the cortical radiate artery, which magnifies here, and these are now cortical artery radiating arteries, which supply the cortical portion of the adjacent kidney lobes, which gives rise to the afferent arteriole that branch off from the cortical radiate arteries, supply blood to the individual nephrons. Arterial artery then get divided into many capillaries which form the glomerulus. So each afferent arteriole delivers blood to the capillary node, which called the glomerulus. Blood is then distributed to the capillaries of the nephron, which known as glomerulus. That's a bundle of the capillaries. From that glomerulus, the blood moves out of the glomerulus by the efferent arteriole. From this, the venous system starts. Above this line, we have seen the arterial supply of the kidney. Below this line, we'll see the venous system of the kidney. So, from efferent arteriole, which means efferent means outside, which carrying blood outside the kidney, and that's efferent artery, which give rise to the cortical radiating veins, collects blood. It follows the same pattern as the arteriole, caudate radiating arteries, um, arcuate veins, interlobal veins, and the renal veins. And then renal vein, it drain into the vena cava. It directly goes to the heart. So we finished it here. So in this image we'll compare the uh, vasculature of the cortical nephron and the juxtamedullary nephron. First we'll talk about the cortical nephron. So in cortical nephron, the nephron loop is relatively short, and the efferent arteriole delivers blood to the network of the peritubular capillaries, which surround the entire renal tubule. Both the both both the nephron and the peritubular capillaries are surrounded by a interstitial interstitial fluid called the peritubular fluid, which called the peritubular fluid. This capillaries drain into small venules that carry the blood to the cortical radiating veins, as shown in this figure. First, blood moves into the glomerulus through the afferent arteriole, delivers blood to the glomerulus where filtration occurs. Then, then arterioles divide into so many capillaries to form the glomerulus in the renal corpuscle. Then the blood moving out of the glomerulus through the efferent arteriole carries blood from the glomerulus to the peritubular capillaries. The efferent arterioles gives rise to the peritubular capillaries, collect which collects water and solutes reabsorbed by the nephron and deliver other solute to the nephron for its secretion. Now we'll talk about the juxtamedullary nephron. The peritubul the peritubular the peritubular capillaries are connected to the vasa recta, which is a long straight capillaries that parallel to the nephron loop. As you can see in this figure, the blood moving into the glomerulus through the afferent arteriole. After forming glomerulus, they are leaving glomerulus as a efferent arteriole, which divides into peritubular capillary, and peritubular capillaries gives rise to the vasa recta in juxtamedullary nephron. These the uh, cap peritubular capillaries and the vasa recta both are same. The only difference is their location. Peritubular capillaries, it's mainly present in cortex, as like cortical nephron. So we can say that peritubular capillaries mainly present in cortical nephrons, and vasa recta mainly present in deep nephron in juxta juxtamedullary nephrons. So we can see that in cortical nephrons there is a peritubular capillary, but in juxtamedullary nephron there is a peritubular capillary as well as vasa recta. So the capillaries of the vasa recta mainly collect and transport water and solids within the renal medulla due to the length of nephron loop and vasa recta. This structure are especially important in concentrating the urine. Vasa recta is important in concentration of the urine. Renal fat and fascia. The kidney are enclosed in and associated with unique arrangement of fascia and fat. Immediately outside the renal capsule, there is an accumulation of extraperitoneal fat, the perinephric fat or perirenal fat, which completely surrounds the kidney. Enclosing the perinephric fat is a membranous condensation of extraperitoneal fascia, which known as the renal fascia. So first one, the renal capsule, then immediately after that there is a condensation of the extraperitoneal fat, that is the perinephric fat, and after that there is a renal fascia covering. So the suprarenal glands are also enclosed in this fascia compartment, usually separated from the kidneys by a thin sputum. The renal fascia must be incised in any surgical approach to this organ. At the lateral margin of each kidney, the anterior and posterior layer of the renal fascia fuse. This fused layer may connect with the transversalis fascia on the lateral abdominal wall. Above each suprarenal gland, the anterior and posterior layer of the renal fascia fuse and blend with the fascia that covers the diaphragm. Medially, the anterior layer of the renal fascia continues over the vessels in the hilum and fuse with connective tissue associated with the abdominal aorta and the inferior vena cava. As you can see in this image, this is the kidney and it is covered by a renal capsule like this, and immediately after that there is a condensation of the perinephric fat. This is the perinephric fat. After that there is a fascia covering, which is the renal fascia covering, which is covering kidney from anterior and posterior side. This is the renal fascia, and on the lateral side of the abdomen, renal fascia is meeting anterior and posterior side, meeting to the transversalis fascia, as you can see here. So there are four coverings of the kidney. First one is the renal capsule. Second is the condensation of the fat, which is the perinephric fat. Third one is the renal renal fascia. Third one is the paranephric fat. But the paranephric fat present only at the posterior side. Remember that. This is the paranephric fat. In some cases, anterior layer may cross the midline to the opposite side and blend with the companion layer. The posterior layer of the renal fascia passes medially between the kidney and the fascia, covering the quadratus lumbosus muscle to fuse with the fascia covering of the psoas major muscle. As you can see here, the, the renal fascia covering the psoas major muscle and the quadratus lumboris muscle here. Inferiorly, the anterior and posterior layer of the renal fascia encloses the ureter. In addition to the perinephric fat and the renal fascia, a final layer of paranephric fat. This is the paranephric fat, which is also known as the pararenal fat, completes the fat and fascia associated with the kidneys. This fat accumulates posterior and posterolateral to each kidney. As I said earlier, the paranephric fat is accumulates posteriorly and posterolateral to each kidney. As you can see, it's available at the posteriorly and posterolateral only. Now we'll talk about the ureters. The ureters are muscular tube that transports urine from the kidney to the bladder. They are continuous superiorly with the renal pelvis, which is a funnel-shaped structure in the renal sinus. The renal pelvis is formed from a condensation of two or three major calyces, which in turn are formed by the condensation of several minor calyces. The minor the minor calyces surround a renal papilla. Renal pelvis narrows as it passes inferiorly through the hilum of the kidney and becomes continuous with the ureter at the ureteropelvic junction. Inferior to this junction, the ureter descends retroperitoneally on the medial aspect of the psoas major muscle. At the pelvic brim, the ureter crosses either the end of the common iliac artery or the beginning of the external iliac artery, enter the pelvic cavity, and continue their journey to the bladder. There are 3 points. There are 3 points while the course of the ureter where there is a high chances to accumulate the kidney stones. So there are 3 points along their course. The ureters are constricted. First one is the at the ureteropelvic junction. Second is the at pelvic brim where the ureters cross the common iliac vessels. Third one is the ureter enter. Third is the where the ureters enter the walls of the bladder. As you can see in this image, this is the ureteropelvic junction. So this is the first. This is the first constriction. This is the pelvic brim ureter cross the where the ureter cross the external iliac arteries, and this is the third one where ureter entering to the bladder. Kidney stones can become these constrictions. Ureteric vasculature and the lymphatics. The ureters receive arterial branches from adjacent vessels as they pass toward the bladder. The upper end supplied by the renal arteries. The middle part may receive branches from the abdominal aorta, the testicular or the ovarian arteries, and the common iliac arteries. The inferior part of the ureters are supplied by one or two more arteries from the branches of the internal iliac arteries. In all cases, arteries reaching the ureters divide into ascending and descending branches which form the longitudinal anastomosis, which forms longitudinal anastomosis. Lymphatic drainage. Lymphatic drainage of the ureters follow a pattern similar to that of the arterial supply. As we see earlier, the arterial supply. Lymph from the upper part of each ureter drains to the lateral aortic or lumbar nodes. From the middle part of ureters drain to the lymph nodes associated with the common iliac vessels, and the inferior part of each ureters drain to the lymph nodes associated with the external and the internal iliac vessels. Ureteric innervation. Ureteric innervation Ureteric innervation is from the renal aortic superior hypogastric and inferior hypogastric plexuses through nerves that follow the blood vessels. Visceral efferent fibers come from both sympathetic and parasympathetic sources, where visceral efferent fibers return to T12 and L2 spinal cord level. Ureteric pain, which is usually related to the distension of the ureter, is therefore referred to the cutaneous area supplied by T11 to L2 spinal cord levels. This area would most likely include the posterior and lateral abdominal wall, below the ribs and above the iliac crest, the pubic region, the scrotum in males, the labia majora in females, and the proximal anterior aspect of the thigh. In this image, you can see a pyelogram, which is an image of the urinary system obtained by taking an X-ray of the kidneys after administering a contrast dye intravenously. A pyelogram shows the relative size and position of the urinary system's main structures, such as kidney, renal pelvis, ureters, and the urinary bladders. The ureters are a pair of the muscular tube that extend from the kidney to the urinary bladder. It covers distance about 30 cm. The ureters are the retroperitoneal and firmly attached to the posterior abdominal wall. The ureters take different paths in male and women due to the variation in the nature, size, and position of the reproductive organs. The ureters take different paths in male and women due to the variation in the nature, size, and position of the reproductive organs. Got it? The urinary bladder is a hollow muscular organ that functions as a temporary reservoir for the storage of urine. A full urinary bladder can contain as much as 1 liter of urine. In this image, this section, this section views a male pelvis, shows the location of the lower structure of the urinary tract. This section views a female pelvis, shows locations of the lower structure of the urinary tract. So this is the ureter, this is the ureter, this is the urinary bladder, and this is the urinary bladder of female, and this is the urethra passing from the neck of the originating from the neck of the urinary bladder, and this is the urethra of female. So the as you can see, the male urethra is longer than the female urethra. So the urethra extends from the neck of the urinary bladder and transport urine to the posterior to the body. The urethra of male and female differ in length and function. The male urethra is longer and transports semen as well as urine, and the female urethra is just past the urine. Here in this image, we will learn about the urinary bladder and the urethra. So, the urinary bladder and the urethra eliminates urine from the body. This process is called the urination or the micturition. First, we'll talk about the urethral bladder's wall. The walls of the urinary bladder contains mucosa, submucosa, and the muscularis layer. The, mus- the muscularis layer contains consists of inner and outer layer of the longitudinal smooth muscles with a circular layer in between these longitudinal layers. So the bladder wall consists of the three muscles: mucosa, submucosa, and muscularis layer. The muscularis layer consists of three layers: one outer and one inner longitudinal layer, and there is one circular layer in between them. Collectively, these layers form powerful detrusor muscle of the urinary bladder. Contraction of this muscle compress the urinary bladder and expel its content into the urethra. Ureter. This is the ureter. Ureter penetrates the posterior wall of the urinary bladder without without entering the peritoneal cavity. They pass through the bladder wall at an oblique angle, which helps to prevent the backflow of the urine. Now, these are the urethral openings. The urethral openings are slit-like. As you can see, these are the slit-like rather than rounded. This shape helps prevent the backflow of the urine towards the ureter and kidneys when the urinary bladder contracts. So there are two mechanisms available to prevent the backflow of the urine. First one is the ureter entering in bladder, making oblique angle, so it prevent after contraction it prevents the backflow of the urine. And the urethral openings the ureteral openings are slit-like instead of round. So at the time of contract they get flat, and it prevents the backflow of the urine into the ureter or kidney. So the trigon, it is the triangular surface bounded by the ureteral opening and the entrance of the urethra. As you can see, this is the triangular shape which known as the trigon. It is bounded by the two ureteral opening and the opening of the urethra. So the, inside the urinary bladder there is a structure called rugae. These are folds of the urinary bladder lining that disappears as the bladder fills. The region surrounded the urethral opening, known as the neck of the urinary bladder, containing a muscular internal urethral sphincter. As you can see, this is the neck of the urinary bladder, which contain the internal urethral sphincter. The smooth muscle fibers of this sphincter provides involuntary control. It provides involuntary control over the discharge of urine from the bladder. As you can see here, in both sexes, in both sexes means male and female, where the urethra passes through the urogenital diaphragm, a circular, a circular band of skeletal muscles form the external urethral sphincter. This muscular band acts as a wall. The external urethral sphincter, which is under voluntary control via the perineal branch of the pudendal nerve, has a resting muscle tone and must be voluntarily released released to permit urination. So there are two walls, or there are two walls to prevent the urinary flow. First one present at the neck of the urinary bladder, which known as the internal urethral sphincter, which is the involuntary, means that sphincter is not according to our control. And the second is present at the external urethral sphincter, which is a voluntary control, which means we can control it. It get innervated by the perineal branch of the pudendal nerve. So that's it. This is the urethra. Here we end with the anatomy of the urinary system. Thanks for watching. Like, share, and subscribe to my channel. Thanks.